Sacred Heart is proud to sponsor Pensacola Histories in recognition of the Daughters of Charity who brought their mission of care to Pensacola over 90 years ago.
Hello and welcome to our continuing story of Pensacola, North America's first place city. And today we turn to the story of healthcare delivery. Now, healthcare is a concern in any generation. And our story of Pensacola, of course, goes back to the DeLuna expedition, where almost at once they suffered a major healthcare problem when a great storm sent trees and branches crushing many people, killing many others. And this was a story when I wish we had a greater detail of it. But for the next 18 months, these people literally fought for survival, battling scurvy and all of the other possibilities that would come along because of a lack of a proper diet. Through the centuries, we had very, very sketchy evidence of what healthcare delivery was all about. We do know that they had problems, and we bring our story, of course, to the end of the final Spanish period, when in Pensacola itself there were more than half a dozen good physicians, led basically by Dr. Sierra and Dr. Brosenham. They were providing care of its type, and this, of course, meant that they had basically no hospital to speak of. But basically, we'll talk about what the fundamentals were as a beginning. Now, the Spanish, in the beginning of the period, the final Spanish period here, had a small maritime hospital right down on the waterfront. It was described as an open building where people were cared for, and of course, one of their great problems was they were frequently beset by fevers, and these fevers, of course, were what gave Pensacola such a bad name internationally. With the coming of the British in 1763, one of the first arrivals here was Dr. James Lorimer. And Dr. Lorimer was apparently a very able man. He was here for almost the entire British period, and happily for us, he made a log of what things were like in healthcare delivery. He continued the use of the same building, the old military hospital right on the waterfront, and he did as much as he possibly could, along with Elias Durnford, the engineer, to assure sanitary conditions and proper care. Now, bear in mind, some of the things that Dr. Lorimer talked about as cures and preventions are almost sort of laughable today, but nonetheless, he was there and he did the best he could. As we move into the American period, things changed just a little bit. More physicians arrived, and through the good efforts of the Navy, we had our first true hospital. This was put in place in the early 1830s on the base at a time when the military was just beginning to function on the Navy base itself, and we also, of course, had the beginnings of the military forts. The man who arrived here that put it all together, at least as far as they could at that point, was Dr. Isaac Hulse, Captain Hulse. He was a physician, and it was to him that we give credit for the establishment of Navy Hospital and for a great deal else that, of course, that was in practice at that time. In the city itself, there was no hospital. We had an increasing number of physicians, and each one of them, of course, practiced on his own. There was no association of the physicians, and one of the great problems that they had, of course, was the frequent recurrence of fevers, and sometimes these fevers arrived here on board visiting vessels. Now, this wasn't an uncommon problem. Along the sea coasts of the United States, other cities were having the same problem too, but particularly with vessels that were arriving out of the Caribbean or Latin America in the summertime. And so the United States Treasury Department decided to do something about it. And they made provision for the creation of what were called maritime hospitals. And a maritime hospital was a very simple device. Basically, the federal government would come into a community and they would pay to lease basically what we would today call a storefront. And then they would enter a contract with one or two physicians, and these men would be paid to care for the cases coming off of the vessels. Now, the government had tried to use the Navy hospital for this at first, but the numbers of patients grew so large that Dr. Isaac Hulse said, now, wait a minute, we just can't do that. We have enough business of our own out here. And this was when Pensacola had its first effort at a maritime hospital. And the building selected was right on the corner of Palafox and Romana. And the building and the maritime hospital opened with a contract to two of the doctors. Well, immediately there was an uprising, an outcry from local people saying that we don't want that. This is a communicable disease. We don't want these people right in the heart heart of our city. So the federal government backed off. They terminated the lease, and they leased another building right about where the viaduct is, or the passageway for the L&N Railroad or CSX Railroad going across 17th Avenue. There was a house there. They leased that building, and they moved the Maritime Hospital there. Well, it opened for business, and within about 48 hours it burned to the ground under very suspicious circumstances. And that was about as far as medical care, for a hospital care of that kind anyway, went up until the war between the states. Our 18 months, or roughly 18 months of the war here, told a different story. By the time the Confederate force had reached its maximum, there were about 6,000 men. The Federals and Fort Pickens did not have nearly as many, but they were operating also in a very confined area. And both of these military establishments were dependent upon getting foodstuffs from outside. The Federals had a terrible time with it. Of course, everything they got had to come by ship. And one of the original companies that had been there with Lieutenant Adam Slimmer, within about 3 months, developed almost total scurvy within the company, and so the whole company had to be relieved, and it was inside of Fort Barrancas and at the Navy Yard. When we got to July and August, well, you can just imagine what it was like. It was hot. We had gnats, mosquitoes, all sorts of other bugs and so forth to plague the people. But the great problem was that most of these young men who were here in the Confederate force were good old country boys, and they had never been exposed, or most of them had not been exposed, to what we would today call childhood diseases. And as a result of that, these young men came down in droves with all kinds of problems. The Confederate doctors that they had here, well, they carried the title of medical doctor, but most of them had very sketchy training and were at a loss to what to do. Fortunately for these young men, or for some of them anyway, the Sisters of Charity, which was at an operating unit in New Orleans, sent half a dozen of their nurses here, and these Angels of Mercy did a lot to help with the care of those Confederates. Well, the war ended. Pensacola was clear, or at the end of the war, Pensacola, of course, had been vacated for several years, and we began to rebuild the city. And as this happened, of course, within 4 years, the great lumbering era, the fishing times, all began, and Pensacola as a community began to grow. And with it, the numbers of doctors began to increase. In 1872, a group of these men, about half a dozen of them, came together, and they created what was called the Pensacola Medical Association. And their goal was to come together regularly to share information, to share the knowledge that was coming across the ocean in large waves now from medical centers in Vienna and London and Paris, to try and integrate that information into their practices here. And they did. However, we still continued here without a hospital, and we would get into the 1880s before the first so-called true civilian hospital was built. Now, this was put together. There would be 2 or 3 of these, and I won't go into the specifics of all of them, but we went through a series of 2 or 3 of these little proprietary physician-owned hospitals, each of which was put in place in a former residence. And by chance, I guess, all of these happened to go on West Garden Street. There was one at the corner of Garden and DeViller, another one a little bit further to the east, and then the third one would be located at the corner of Balin and Garden. And all of these, they were small, 10, 15 beds perhaps, and basically the care that was given there was given directly by the physician. And nursing care was, well, I think the story needs to be told because it was so unusual. At the end of the Civil War, we had seen the epic work done by Clara Barton and other women, Angels of Mercy, who had taken a page out of what Florence Nightingale had done in the Crimean War, and these nurses working with the Union Army had been very successful. Well, one would assume that once the war was over, nursing schools would develop, and these young ladies would be trained in great numbers to serve in hospitals everywhere. But that didn't happen, because some very conservative religious elements came to the fore and said, no, this is wrong. This is wrong. We cannot having proper young ladies dealing with the bodies of men. And as a consequence of that, the nurses that appeared, that did provide whatever service there was in most of the hospitals, were men who were former patients. These were medically indigent people, many of them off of visiting sailing vessels. They had been cured by some miracle, and now they were to pay off their bill. They were assigned for 30 days or more to be nurses. Well, you can just imagine the level of kind of care you would have gotten from someone like that, and how compassionate these people would have been. And that's basically the way things continued here until 1895. At that year, two of the young physicians, Doctors Renshaw and Anderson, opened a new company, and they created what was going to be called their infirmary, and it was going to be located on the corner of Balin and Garden Streets. And they were going another step further. They went north, and they employed a young lady who was one of the very first graduating classes of professional nurses, and this young lady was the product of a school at St. Vincent's Hospital in Chicago. Another one that had come into action at about that same time was the Johns Hopkins Hospital Nursing School in Baltimore. But these were the very first, and Pensacola was so lucky to have the selection made, and the young lady who came here was named Elizabeth Crowell. Miss Crowell came, and her title was Superintendent of the hospital. And she hadn't been here 6 months, then she started her own little nursing academy for other local girls, and as a consequence, Pensacola began to develop a whole fraternity, or a sorority, I guess is the right term, of nurses, and care obviously improved dramatically with that. Now, as all of this was happening, the medical profession itself is growing. You're getting more and more people here. You're getting more people who are capable of helping with what we would call difficult epidemic situations, because Pensacola, as it had from the very beginning, continued to be plagued by yellow fever and other fevers, which the medical profession just did not understand. They didn't know what to do about them. All they knew that they could do that helped was to keep the patient quiet, keep them cool as they could, use ice where it was possible, and of course the use of quinine and later aspirin became into use about this same time. And so we move into the early days of the 20th century, and the county itself has had one other episode that we must remember. Now, this isn't exactly medicine, but we had talked about it in a prior episode, but we need to incorporate this under health care. This was in the early 1870s, at the time when it became more and more obvious that we had disabled American Civil War veterans and veterans' widows. And it was at that time that the county didn't know what to do with them. They had to find some way to care for these poor people, and so they created what was known as the Poor Farm. This was a kind of an old folks' home, if you will. But at the same time, they began to have trouble with infectious diseases that were breaking out in the community, and the county didn't know what to do with them. And so, for the very first time, the county created what we would today call a hospital. They called it the Pest House, and this is where they took fever patients and others of that kind and cared for them. So you had the Poor Farm and the Pest House, both of them located out on what we today call West Leonard Street, and this was part of the early healthcare establishment, if you will, for the community. And that's basically where things stood as we entered the 20th century. The Poor Farm was there, the Pest House was still there, and the physician load was beginning to come. We've had more and more men of some quality, and I want to just mention a couple of these people: Dr. J. Harris Pierpont, Dr. William Pollock, Dr. James Herron, Dr. Sam Gillespie. These were all men who were doing well. Dr. Herron, for example, was the man who literally created a small hospital on his own just to take care of people coming off ships. He was a kind of a throwback to the maritime hospital idea. He utilized what had been the old Panton Leslie warehouse as his hospital, and it was right on the waterfront. And he cared, by the way, he cared for the typical patient for $2 a day, and it was $2.50 if the patient had an infectious disease. More on this later.